Since I retired, I stayed pretty active. I loved to work on old motorcycles specifically. I would ride. Back in January, I had a problem with my legs and that I couldn't walk very far, about literally 30, 40 feet at a time, and I'd have to stop and rest for 10 minutes. My right heel started hurting one day, and so I went to my podiatrist. And he said, well, no wonder your leg hurts, you got a big hole in your foot. And he said, I bet you've got poor circulation. So he got me set up with an appointment at a cardiologist and was diagnosed with peripheral artery disease in both legs. He tried to do a catheterization. It was too plugged, they couldn't get at it, I had a bad reaction to the anesthetic. So he suggested I go see Dr. Smeds.
Peripheral arterial disease is blockages in the arteries of your legs. That can be mild, where you just have some pain on walking called claudication, or it can be more severe when you have symptoms like tissue loss or wounds on your feet that don't heal, or rest pain, which includes pain in the balls of your feet at night that are better when you stand up. Those two last things I said there are grouped together in something called critical limb ischemia. When a person has critical limb ischemia, if we don't do something to revascularize their legs, they have a high chance of losing their legs within a year. And this patient presented with those findings of critical limb ischemia, so he had a high risk of losing his legs. The CT scan demonstrated that he had a blockage in his iliac artery, which is kind of in the abdomen actually, going down to the leg that kind of feeds the leg. And he also had a blockage in his groin level, and then he had a blockage in his thigh level. So he had multi-level disease, which would explain why he had such severe symptoms.
Went to surgery. They put me asleep. I don't remember a thing about it. When I woke up, I had a big scar and stitches. I must have had 60 or 70 stitches. And they had my leg fixed, for the first time in I don't know how long. I could feel circulation in my legs and my feet. And it was awesome because I walked in an enormous amount of pain and walked out 3 or 4 days later after I recovered, after the ICU and a 2-day stay in the general hospital. I walked out with no pain. It was unbelievable.
So we ended up doing a kind of multi-procedure on him, all in one setting, but we ended up putting a stent in his iliac artery. We cleaned out his groin artery with a direct approach, and then we ended up doing a bypass of his lower extremity. And so this was a case where we kind of used every skill that a vascular surgeon will use. We used endovascular skills, which is basically using wires and stents to open up blockages. And we used direct surgical skills, which included the endarterectomy, which is opening up the blockage directly, and then the bypass graft.
I was just treated the best you could possibly imagine from the minute I walked in to the minute I walked out. Everybody. I had visiting nurses come over, and I had a visiting nurse. I had a social worker to make sure that the home environment and everything was fine. And I had physical therapists who came over and worked with me and got me walking. And now I can walk as long as I want. It was, just a big change and completely changed my lifestyle. Because because of going through all of that, they also determined that I probably had blockages elsewhere, and it turns out I did in my heart. And because of that, I had heart surgery later on. I could have dropped dead at any minute, but they actually, convinced me that I needed further testing. So, yeah, got my life back. And I feel like they saved my life,